Well, hello, everybody. Good afternoon or good morning, depending on where you are in the country. My name is Garrett Schmidt. I am the managing editor for VBC Exhibit Hall, and I'd like to welcome you all to today's live webinar that's hosted by Propeller Health. And very excited to hear from our speakers today, who I'll introduce in a moment. Today's session is called 2024 Outlook, Navigating the Digital Health Landscape for Value-Based Care. So an interesting topic, and I think you guys are in for a really great presentation today. A few items of note before we get started. This is a traditional webinar format, so you don't need to worry about muting your microphone or turning off your camera or anything. We can't see you or hear you, so don't worry about that. However, as I always say, we do want to hear from you, and we're going to have a time for some audience questions towards the end. So if you have a question at any time during the presentation, go ahead and use your control panel to drop the question in where you'll see where it says questions, which is different than the chat feature. So go ahead and put your questions in there. We're going to get to as many of them as we possibly can today. If we don't get to yours for some reason, or we run out of time, don't worry. Someone will reach out afterwards to answer your questions. So even if we're just wrapping up at the last minute, go ahead and ask your question there, and someone will get to you. But we'll try to get to as many as we can. And speaking of today, we also introduce our MC, if you will, Jillian McNamee, and she is with Propeller. She's going to help us with the Q&A, and you'll get a chance to meet her then. And lastly, today's session is being recorded. So when we're done here, you're going to receive an email from one of us, and it will have a link to the recording as well as to where you can get the slides from today's session. And so that way you can watch it again or share it with your colleagues, and we hope that you do. All right, well, without further ado, let me briefly introduce our speakers today. We have Miss Jessica Hoffler, and she is the Chief Operating Officer with Digital Therapeutics Alliance. And we also have Miss Susa Monticelli, and she's the General Manager of Propeller Health. And so they'll be the ones actually guiding our discussion today. And again, you'll hear from Jillian during Q&A. So welcome, ladies.
Thank you so much, Garrett. So let me share a little bit about myself just for context and for that lens to that ever-ending prism of views on the digital health landscape. It's really been colored by both my experiences here at Propeller today, but also prior to that with PrimaSun and Onduo. And then 10 years on the payer side that was preceded by also experiences in the provider landscape where I worked in hospitals as well as in the Silicon Alley early days as we were starting to do digital with pharmaceutical companies. So a little bit of a smattering of experiences that provide some of the perspective that I am going to be sharing with you today. And with that, I'll pass it over to Jessica.
Hi, thanks, Susa. Jessica Hoffler. I started my career in social services, so always looking to expand patient access to care, get the right care to the right person at the right time. That still motivates me today in the digital space. Prior to DTA, I spent some time on the health plan side as well, but working on an external innovation team. So working with external stakeholders on how to bring innovations into the organization and also how to use our influence and our problems that we are facing within the health plan and educate and inspire some external stakeholders, whether those are digital health entrepreneurs or policymakers, or all different types of stakeholders within the healthcare system. And now I've been at Digital Therapeutics Alliance for the last 3 years and find it incredibly inspiring to work with all types of people who are bringing new types of healthcare to people all across the world. Yeah, and with that, we'll dive right in. So there is a full spectrum of digital health technologies that exist out there, and they continue to evolve and mature over time. So here's a snapshot of what we're seeing now. On the far left side, you can see that there are health IT, really clinician or health plan or somehow health system administration facing, not patient facing. That would even include a fax machine, I suppose. over on that end of the spectrum. Then as you move towards the right, you start to see more patient-facing digital health technologies. So you might see some monitoring, virtual care, telehealth, health and wellness products that are disease agnostics. They could be agnostic, excuse me. They could be fitness trackers, or they could be wellness tools that help cope with stress. They're not clinical grade, is really what separates them from a therapy. I think I already mentioned remote patient monitoring, different types of clinician decision support, diagnostic tools, and then on the far left, you see digital therapeutics. So it's software that deliver a medical intervention directly to the patient. So that way it's not clinician decision support, it's going directly to the patient, and the product makes a medical claim to treat, manage, or prevent a disease or disorder. It uses clinical endpoints to measure efficacy, and that's how we get towards all the evidence that goes into creating a digital therapeutic. They use clinical trials that are peer-reviewed, and there's often oversight by the FDA or other regulatory bodies. So that's really what we're going to focus on today, are the digital therapeutic side of the DHT spectrum.
So we thought that what would be interesting is, as we think about value-based care, it obviously starts with kind of what is the impact that you can have, and how do you think about some of these therapies, and whether you are anyone in the value equation, from a pharmaceutical company to a payer to a health system to an individual provider all the way to the patient. There's a number of different elements that are important, that they all come together holistically just to create that meaningful outcome. And so we'll talk a little bit more about that from a Propeller lens, and what we've done as a digital therapeutic company, and some of the things that we've started to see across population levels within our product. The second, and so I'll kind of introduce these very briefly, but we wanted to spend a minute opining on all of them. The second that we wanted to talk a little bit more about was just quality metrics. Obviously, there's a lot of established quality metrics out there already, and there are new ones that are emerging as digital therapeutics are getting greater and greater adoption. And so the landscape is somewhat defined, but it's also starting to take shape in a different way. And then we wanted to also dig into a little bit more of the holistic approach as we think about prediction and prevention. Our systems are so reactive today, but as Jessica and I were talking about this earlier, you really have this opportunity with data to start to move from being a reactive and responsive kind of system to really being a predictive and a preventative system. And that's really kind of the effort that we've done across the board, in terms of not just within Propeller with COPD and asthma, but also within other digital therapeutics that are emerging in the market. So I don't know if you want to opine a little bit, Jessica, on what you've seen from a DTA perspective as it relates to kind of, we can maybe start with the budget aspect of it and talk a little bit about outcomes.
Yeah, I look forward to hearing more about your direct experience, but what we're seeing in general with the budget impact is that there are a lot of different adopting stakeholders, whether they're provider systems or health plans, that are starting to use these tools and starting to realize how it impacts their budget. Sometimes they can be cost neutral, sometimes they can add on. But when you look at it in the long term, we really start to see some interesting data come out. And I know you're going to get there, Susa. And then the quality metrics continue to evolve because digital products have so much data. We not only gather quality metrics from clinical trials, but everyday use. And so we generate that real world evidence constantly, and we can measure quality in all sorts of ways that are novel to the systems. And then when I think about these digital products, I think about how they are caring for people in a more holistic way. They're caring for the whole person. They address many comorbidities that traditional therapies can't do. And they continue to evolve, and there are so many more in the pipeline that are addressing issues that people who have a specific condition are facing. So it's a really great opportunity to improve care for the whole person.
So with that, we can dig into a little bit more about kind of some of the outcomes. So one of the things that, as Jessica was saying, when we start to think about kind of the clinical trials versus really what's post-market evidence and start to look at what is the true impact that we're having, these are obviously on average per population level. As we think about the cost savings, they obviously vary on that very individual level for a patient. But when we think about this from a payer perspective, whether you're a commercial payer or a Medicare payer, there's obviously some differences in those populations, and the outcomes that we see vary a bit by the type of insured population that we work with. But in general, it is really important to think about what is the impact that these solutions can have. And so for us, the goal has been to really leverage that prediction and prevention and really lower kind of the need for care escalations for our patients, because it speaks to quality of life for the patients, it has financial impact on the patients, and it drives overall costs across an entire population. And so as we've taken Propeller, and you see here on the right-hand side, for our digital therapeutic, we have 10 devices that have FDA and CE clearance, and we're in about 18 countries. What we do is we connect inhalers so that both the patient can receive the information or the physician can receive the information through either a third-party portal or through an EHR system. And one of the things that we found really interesting about our product was that to create these types of outcomes across a population, it's really important to meet the patient where they're at. So one of the biggest discoveries that we had, and I love these terms because we all use them, right? We're all into this lingo, meet the patient where they're at. Well, what does that mean? For us, it meant that we had to create a completely app-less experience for our patients. And as a digital therapeutic, that felt really uncomfortable because early on, we really felt that the app was the way to go. But we realized that not all patients are equally comfortable using apps. They may have smartphones, but they may not as actively be using apps on those smartphones or be as comfortable with Bluetooth connectivity, et cetera. And so that was one of the key innovations that allowed us to take that kind of general term of meet the patient where they're at and really pivot it to really understanding our patients and understanding how they prefer to engage with us. And now today we have both a means of connecting through a phone app, but we also have a means of connecting through a hub that allows clinicians to capture that information and improve their clinical decision making, as well as intervene with patients much earlier in their care journey when they start to see exacerbations. And so I don't know, Jessica, if you want to kind of, you've obviously seen this across a number of different companies that you work with through the Alliance, but do you want to comment a bit more on that?
Well, I love how you mentioned in so many terms your ability to personalize the care delivery to the patient. And that's really important in terms of patients actually using and engaging with the product. And it's another thing that's very unique to digital products is that they can be more personalized, they can be more culturally competent. And so in order to really achieve the outcomes that we're all looking for, those are the types of qualities that digital therapeutic products ought to have in a way to meet the patient where they are.
If we go to the next page, you know, we think a lot about, in addition to kind of the financial impact that these solutions can have in creating that value, it's really important to also think about what are some of the quality metrics that digital health can impact. And from our perspective, as we kind of look at, for example, just within the ambulatory care environment, what are some of the key measures that asthma and COPD can really speak to? And when we think about kind of those comorbidities that Jessica was talking about, when we start to treat our patients for COPD and asthma, we also can impact in closing gaps in care for a number of comorbidities because we engage the patients and we get that connectivity with the patients. And so what we've seen across the board across many of these asthma, COPD, preventative screenings for more kind of primary care and cardiovascular and diabetes, we see impact across the board on all of these metrics when we implement even a solution that's specifically designed for diabetes. And in some ways, asthma and COPD engagement can also be seen as a predictor. So it becomes a primary predictor of things that can exacerbate for some of the other comorbidities and can help us not only prevent things that are happening within just the care of asthma and COPD, but also create those early leading indicators for some of these other comorbidities. And so this slide to me is very powerful as we think about it from a kind of a solutions perspective, but I also feel like it's starting to change. And I don't know if Jessica, if you wanted to opine on that a bit.
Well, it's certainly evolving. I think as more of the products are maturing and stakeholders like NCQA and FDA and other of those stakeholders that look at quality metrics are understanding the capabilities more, they're seeking out more and more data. And the health plans want to see more data, and the health providers want to see more data. The great news is that digital products have the data and they can show the data. So we're working very closely with all of those stakeholders to understand what types of data can be generated, how quickly, how they want to view that type of data, and how health systems can ultimately ingest that data, which is a tough part because a lot of times health system technology isn't quite there yet, but we have it. And it's a really exciting time to be working with all sorts of people.
So if we go to one of the things that, you know, everyone is kind of now talking about, and I think this is one of the things that we teed up earlier around predict and prevent. And that was perfect tee up, Jessica, on data. But for us, what we've done for asthma is try to really believe in this predict and prevent. How can we bring disparate pieces of the information together and try to find where the correlations exist? And in this particular example, we used machine learning models in order to be able to determine what actually mattered, and boiling it down to your rescue inhaler use and air pollutants. And depending on a particular market, we can actually provide information to patients who are using our app on the air quality and what the forecast looks like for that day. And based on kind of their use of their medications, are they at a higher risk for that day? When these are the types of insights, you then know that you can take your inhaler preventatively, or that you may want to reach out to your provider if you're not sure about how to address an increase in air pollution, for example, in your area. And so it's always interesting when I hear people talk about AI and ML, because I feel like we're still so early on this journey. But for me, at least, it's been really exciting to start to see these applications become very real, even within our own business, and to start to have that impact that then ultimately drives towards that value-based care. But it's knowing kind of the maturity and knowing the amount of data that's required in order to do that. We've obviously been in business for quite a while, and we have longitudinal data and across a variety of populations that helps to feed these algorithms, because not all populations have the same experiences, and not all geographies have the same experiences and the same predictors. So we're looking forward to continuing to fine tune and continue to grow these algorithms over the next foreseeable future to, again, get to that nugget of predict and prevent.
Yeah, that's so cool how your product and others are able to integrate some of those social determinants of health, you know, where you live, the air quality, even the amount of sleep you're getting, the food that you eat, and how it may impact blood glucose levels, especially for a diabetes patient, and that may then impact the treatment for that day. Or even how what you eat could impact the potential for a migraine. And so there are interventions that can be delivered through digital therapeutics that use all of this incoming data to help inform patients on how to treat themselves. Really, really cool stuff.
I'll say one last thing that it's very pragmatic, but that we've experienced is the hardest thing that we found is what is the right insight that you want to generate. With so much data, you can generate so many interesting things, and it's like a giant rabbit hole or an ocean that you start swimming in, and it's so easy to get distracted from what is actually digestible by patients and actionable by patients. And so that's one of the things that I would highlight, that as you consider how digital therapeutics can impact value-based care, it is important that these solutions are really targeting the few things that make the biggest difference, because as human beings, we only have so much share of mind and ability for input and advice, especially on an ongoing basis. But when you find something that becomes like a daily predictor like this is, it is something that you then begin to rely on having and being able to lean on as a patient. And that starts to create that ongoing engagement, because you have found that one insight that creates meaningful value on a daily basis for the patient. So just some things to think about as you continue your journeys in value-based care.
Yeah, that's so true. The right data at the right time.
You were saying that earlier, but it really is, and it really is not just about finding the patients at the right time, in the right place, and with the right openness. But now it's become that fourth pillar of, can we get the right data to the patient at the right time to inform the right decisions, I guess would be the way to frame it.
Yeah. You know, there are other stakeholders too. The providers want to see the right data at the right time. They don't want too much data. They just want what they need to know. And that kind of gets us into the next dialogue, which is around 2024, which is just a few weeks away. So something that we're already starting to see, and I think that will just accelerate, are increased diversity in stakeholders that are looking at digital therapeutics. And I know we'll go deeper into these topics, but so many more stakeholders are interested and are becoming a part of the ecosystem. There is a lot of growth expected, particularly around disease states that will be addressed by digital therapeutics. And then we'll talk about things to consider when implementing digital health technologies into your systems. So the diversity, so Digital Therapeutics Alliance is an association. We work with all types of stakeholders who want to support the advancement of digital therapeutics into the standard practice of care. So we not only work with digital health companies and manufacturers, but there's a lot of pharmaceutical companies that are interested in partnering or building their own digital health technologies, either to be standalone or complement their existing therapies. We're working with a number of health plans, PBMs, CMS, and CMS equivalents across the world on evaluation and reimbursement models. So those are big initiatives that we partner with them on. We work a lot with provider systems, really on integration and how to talk to patients about these new types of technologies. And in general, clinicians love it. They get it. They want to use it more. They know that they need help. They need more time, and digital products can mitigate some of that so that their patients can have more care options. Something interesting is we're seeing more academia get involved, both from the education perspective and including digital therapies in their curriculum, but also when you talk about tech transfer programs out of academia, they want to be a part of that. They want to be, first to scale any type of technology, medical technology. So they're getting more and more involved. We also see more partnerships with medical societies and patient advocacy groups, all types of alliances and associations across the healthcare spectrum. So that's really exciting to see more interest and more awareness.
I'd say I'll comment a little bit on the DTA, but I've seen a really kind of over the last 3-4 years as you guys have grown a lot. There's been really a shift in kind of the makeup. In the beginning, it was a lot of entrepreneurs who were trying to make a difference within the digital space and looking for that partnership, thought partnership and collaboration across kind of other entrepreneurs. But now what we're starting to see much more is that individuals from the payer, the provider, from academia, from life sciences are actively getting involved in the alliance, whether it's on a board level or within the various different committees. And it's really creating more of a surround sound and really bringing people together to try to solve some of the challenges that we still have in making digital therapeutics a standard of care versus that augmentation of care. And so I personally am looking forward to seeing every year those percentages go up in the number of physicians who are prescribing digital therapeutics actively. I think most indicate that they're willing, over 80% indicate that they're willing, but only 22% or so have done so to date. And so as we think about it from a Propeller perspective, that kind of common acceptance of digital therapeutics and embedding into EHR systems or others becomes more and more important to making headway to becoming that standard of care. I will say as the GM of a digital therapeutic company, this is all the list of stakeholders that we also need to partner with and work with. And back to kind of the earlier point that I was saying is that it's important that we generate value, not just for one stakeholder, but across the stakeholders, inclusive of these, but also our patients. And so Jessica and I spent some time earlier talking about how patients are really at the center of this. And as much as we can create demand within our own ecosystems and within the provider and payer ecosystems, ultimately the patients still hold that key in terms of determining whether it creates that right type of value and engagement for them. So just some things to think about as you enter into these value-based arrangements with digital therapeutic companies.
Yeah, and then expected areas of growth. We're seeing so much. I mentioned before the holistic approach to care. When we think about digital therapies that are addressing comorbidities. So we can think about the precision and targeting in terms of, today digital therapeutics can't cure cancer, but they can address nausea to help keep a patient on their course of therapy. And we see digital therapeutic products that are targeting depression and anxiety that is experienced by people who have psoriasis, for example. So very more specificity to help people stay on track and be healthier so that they can ultimately get better. But they also are addressing, IBS, MSK, all the other acronyms out there, anxiety, PTSD, migraine, so many conditions out there, and the pipelines are just getting bigger and bigger. So it's really exciting to see so many conditions being addressed.
I would add to that it's, what we see with our patients is that they need the solutions to be relevant to them and their circumstances. And we talked a little bit about even the differences within a commercial population and a Medicare population. Understanding kind of the precision within a disease condition and being able to tailor a solution for a COPD patient who is also struggling with depression because of the COPD and their circumstances, that's creating that kind of precision across those comorbidities, but also having a little bit more holistic view of who they are as a person and the circumstances that they're living in really starts to bring in those social determinants of health components into the discussion as well. So as you are evaluating solutions or looking for solutions, recognize that we're early in this journey and some of this is still starting to formulate, but the ongoing information and data and knowledge that you're beginning to build and the muscles that you're building within your organizations to adopt digital therapeutics, this is an opportunity to grow and inform and partner, especially on the data front, to create more of that impact and drive greater value for the organizations and for the patients.
Yeah, we can touch on too. I've worked with some global health leaders across the world and impact investors as well. And they're really looking at the global health perspective in terms of adopting digital therapeutics, really being able to reach out to some of the more remote populations, help people who don't have access to any health care. And I'm seeing some work in women's health in particular, and then also around substance abuse for populations that are abused or experiencing sex trafficking. So, getting it back to those very targeted populations that need some support, those are areas that are being considered in global health initiatives.
I think it's interesting on the access piece. One of the things that when you think about COPD or asthma or even diabetes, if you're struggling in managing your insulin or if you're struggling with breathing, having predictive indicators, and especially when further kind of more extensive care is further away, is really important for maintaining those costs down and creating quality of life for these patients. So if you use the data to predict and prevent acute episodes, it goes a long way for creating, again, an impact on the population and being able to have the kind of outcomes that I think we're all seeking across our populations at this point. I think you're going to go to the next slide. Outlook, do you want to tackle this one first?
So, things to consider. This isn't special for 2024. It's always, something to consider, but just recognizing that there are new ways to do the same things. So what outcomes are you looking to impact, and what problems are you looking to solve? There is an existing provider shortage, and I don't think anybody can argue that. It's been studied many, many times. And how can we solve for that problem? I think digital health is one way to do that. So when you're thinking about provider experiences and provider shortages, patient experiences, cost, and quality, those are all the quad aim components. So if you think about it from that lens, how can digital products support all of those really important efforts? And depending on how you want to target those problems or outcomes, there's likely a solution for you.
I'd say on the first two questions, kind of outcomes, those can be very specific to a particular population, and they can be very focused on clinical outcomes or cost impact in terms of the patients and the payers of the organization. Everything kind of depends on where it is that your focus is on. I will say I've seen a very big change in our conversations with our clients, not just talking about cost and quality, which have always been kind of front and center on digital therapeutic fronts, but the workload. And one of my favorite expressions that I've adopted along the way from colleagues is the concept of negative work. And can the solution actually, instead of increasing work burden on the physicians, remove that burden from the physicians or from the providers, whether it's nurses, RTs, et cetera, and help provide a more targeted and focused approach to the patients. So for example, if you're managing a population of 100 patients who have asthma, instead of trying to track all of them and figure out who's out of control and who's in control and who should you try to intervene with earlier, having a solution, a digital therapeutic solution that says, hey, these patients are not compliant with their medications, or they're using their rescue inhaler a lot more frequently suddenly, it would be a good idea to reach out to them more proactively. It allows the providers to focus their time and energy on where the greatest need is within the populations. And that also has implications on the cost side. Again, getting to that predict and prevent. So it's really meaningful, I think, from my viewpoint, that as I look at other digital therapeutic solutions, I've started to really not just kind of push on the cost savings and the quality impacts, but also on kind of what does this mean for that workflow for the providers, because that again will speak to the speed of adoption and the value that organizations see in the solution. I think the other thing that I would also say in conjunction with that, though, is that one of the challenges that we have is not really knowing which therapeutics are going to be adopted by our provider groups, for example, and how to kind of simplify that, because I do think that the burden of implementation is a big consideration. And I often think that we start with the end state, but sometimes it's easier to think about things in horizons and think about, is there a quick way to start to create learnings and create that momentum within the organization, and then do a deeper investment into integrations and other things. That would be something that I would ask. And again, it's about the scale of impact and how you want to bring a solution to bear within your organization, whether you're willing to kind of take the upfront effort that it takes to really integrate it into the workflow, or if you're willing to add a little bit of workflow burden in the beginning so that you can start to experience the value of a particular solution. That's a conversation that we tend to have, and it creates an interesting yin and yang on kind of taking that cost and quality impact versus that physician flow impact and how you want to navigate that. And that can be very personal to where you are in terms of your technology journey and your budgets and the burden of the particular population that you're looking to treat.
Interesting. And I hope that that's getting easier along the way. You know, this last year we at DTA took on a big initiative around integration and workflow. And so I know that we discussed an overview of stakeholders previously, but there are so many more players in healthcare. As we know, it's quite complex. And so one barrier to adoption for both health plans and provider systems were that digital therapeutics used to not be listed in pricing compendias, and then able to be pulled through the EHRs and then ultimately getting pricing information to health plans. And so we worked with the pricing compendia, the top 4, and happy to say now we have a checklist for submission, for DTX submission into compendias, and they're all listing prescription models of digital therapeutics. So we are working with all of those stakeholders to alleviate some of those pain points in the integration and workflow that we're all experiencing as technology evolves.
I think there are 2 other things that I think are something to think about as it comes to your organizations, and this is more selfishly as, again, kind of a digital therapeutics organization that's looking to scale and grow, is what is the process of creating contracts, and what is the burden of, as you see here, on the security and the privacy elements, because there's a balance to be had in terms of having that proof and validation, as well as then having the complexity and the time. And the difference between a well-oiled pathway, if you will, you can contract the digital therapeutics company within 60 to 90 days and get going, or your process can reach over 360 days. We've had experiences in both kind of extremes as a company, even after you get stakeholders to a yes, we want to do this. And as many of you know, there are many stakeholders that you work with within your organizations to get to a yes and to build on a therapeutic solution. And then the last thing I'll say on that is that it's not just kind of the undue burden of kind of the contracting and getting through security and privacy questionnaires, but thinking about once you sign up, then what? How do you get the key stakeholders in your organization, whether it is the folks who need to read out the reports from the insights, or whether it's the folks who need to actually do prescribing within a provider organization? What's the engagement plan there, and what's the comfort level of the organization for really getting behind these therapeutics? Because it's easy to kind of sign the contract and put one foot in, but not quite think through what does that implementation look like and how will that engagement happen and how comfortable are we as an organization to do the kind of education, promoting, and engagement of the key stakeholders along the way so that those outcomes can be achieved. And so those would be some of the things that I would just encourage to have some open dialogue with companies that you're looking to partner with so that you're set up for maximum success as an organization.
That's so important. I'm glad that you mentioned that. We at DTA and member companies, and with the support of about 300 clinician and payer representatives, we created a value assessment and integration guide a couple of years back. And it's not an assessing tool, like grading on a scale if something is good or not, but it does list out all of the evaluation components that a health system ought to consider, because a traditional P&T committee doesn't consider data privacy and security. So it's a reminder that here's a new thing that you're probably going to need to loop in your IT team about, or compliance team about, that maybe you're not used to doing. And it's a really helpful reference.
I think we had one more slide, and then I think we're going to move into some Q&A.
Hello, as Garrett mentioned, my name's Jillian McNamee. I'm here to facilitate that Q&A. Thanks so much, Susa and Jessica. I think we're actually got to the point where we've got a couple of questions queued up. I just want to remind everyone that you're welcome to submit your questions, and we'll try to get to them as we have time. So please go ahead and do that. But the first one, I think, kind of touches on where we left off, right? Like, how do you think about implementing digital in 2024, and then really focusing on the value? What is the value? Why should you start to look at these solutions generally? So maybe we start with you, Jessica.
Oh, sure. Really getting back to why I am here in this space is that there are so many gaps in healthcare that people are facing, whether it's they're in a rural environment and can't reach a provider, or are in an urban environment and can't reach a provider. Maybe they're not comfortable with a provider for various reasons. And maybe they haven't found the right drug for them. I myself have a chronic condition. It took years to find the right drug and the right dose. So, just having more care options is better for patients and can ultimately lead to better experiences for patients and providers, cost savings overall if we're saving people from going to the ER if they can't breathe. Having some of those predictive and preventative measures in place to keep them healthy before it exacerbates. We have the tools now. They just need to be integrated, and just better care for more people is, to me, the value of investing.
I would add to that something that we didn't dig into yet, but I would add to it one thing, which is, I really feel like access is so important, but it's also having a greater impact on equity. And so as we look across populations, we find that there's still a lot of disparity in access and comfort in accessing care. And digital therapeutics have a means of being almost a gradated approach to helping a patient get comfortable with their condition, understand when they're being exacerbated or when they're having challenges, and also facilitating that dialogue with a fact base with those physicians, making some of those interactions more comfortable. And I think that as you have kind of the means of thinking about how a digital health solution fits in within your portfolio, again, we talk a lot about quality, we talk a lot about cost, we talk a lot about access, we talk about provider impact, but those are some of the top things that I would continue to be inquisitive and understand kind of what you're getting into. But I would also on the flip side say be brave, because you're not going to get the outcomes day one. It's kind of like going to the gym and wanting to build that next level of muscles. It takes quite a few trips to the gym for that muscle to build and to be consistently there for your next marathon or ski season or whatever it may be. But it's a little bit similar when you're approaching value-based care, is that if your heart is in it for a year and you're just looking to do a quick 50-person experiment, that's a very different commitment level, and the insights that you're likely to gain at this point for a lot of therapeutics are very small compared to the wealth of literature that is already out there around a lot of these solutions. It's more kind of getting your organization comfortable and getting it into the workflow and recognizing that will take time, but that the value continues to build year over year. You will see improvements in that first year. Absolutely. You'll start to understand your populations in a way that you've never seen them before. And that knowledge takes time not only to be gathered, but also then to be fed back into the organizations and to create the right types of actions that really allow you to maximize the value. I'd say on average, I see the value really beginning to build in year 2 and really starting to hit kind of that I wouldn't say maximum, but start to hit kind of a standard clear contribution in year 3. And that's a good way to look at it across the population from my experience.
I want to follow that thread a little bit that you had talked about in terms of patient access and equity to care. I think one of the things that is so important to the success of these digital health programs is that patient engagement aspect. So do you see any sort of, innovative approaches or technologies that are going to enhance patient engagement in digital going forward?
Well, they can all be so personalized, like I mentioned before. And one of the another great component of digital therapeutics is that they're accessible wherever a person feels safe and comfortable. So that might not be at home. It might be at school or at a friend's home or at work. So wherever is convenient and safe for that individual, they can use that tool. And they can, they can be created or developed to target certain populations and certain cultures. So their dialogues in their trainings can be more culturally appropriate. And so some cultures, may like that more than others. And so they can just address more cultures more specifically.
Jillian, can you repeat the question again?
I was just kind of thinking about how patient engagement is so critical to the success of, digital health programs, and what you're seeing in terms of innovations or technologies that are going to enhance that going forward.
I'd like to answer it in 2 different ways. And the first one to me is that first we have to understand our populations and what does good engagement and good outcomes look like for you. And I used to think that as I started to work with the digital therapeutic companies on the payer side, engagement was a big measure that we always looked at. How often is the person getting on the app? That was the most frequent question I got, right? On any solution that I was looking at, because I thought an engagement was a predictor on how well the cost savings would actually be driven. And the longer that I've worked in digital health and created these solutions, I'll just broadly talk about 4 categories of patients really quickly. But to me, it was pretty standard to know that some people require a lot of nurturing, and whether that's done through an automated, I've seen quite a few amazing solutions that use avatars out there, especially in oncology and some other areas, including sleep, and they become kind of avatar coaches. And that's one level of an engagement, but they're frequent engagers, whether they want a human touch, whether it's through texting or using an app-based messaging platform, or whether it's even phone calls. And we see that through our customer service line too, is that some people just call because they want to know that somebody values their efforts and is there to support them through that. Obviously, that can be high cost, especially if you're using coaches to answer the phone and spending a lot of time talking to patients on the phone, and for a variety of reasons. And so, so that's something to be mindful of and think about what is the right level of engagement within that population. Then you've got the folks who kind of engage with you intermittently, and I'd call this kind of the second category of folks. And what does good look like, and what does a good outcome look like for them? They'll engage with you for a little bit. It's kind of like going back to my personal training journey. Sometimes I'm super engaged and I'm working out all the time, and then it slowly starts to wane a little bit, and then I'll use a friend or a trainer to get me back up to that workout level that I aspire to. And it's similar things that we see in other digital therapeutic solutions. Patients will engage for a while, then they'll kind of drop off again, and then they'll come back. And what does a good outcome look like for those patients? And what kinds of measures are you looking to evaluate those patients and support them through their journey? And then you've got the kind of get it, got it good population, which is, hey, I've been with you for 30 days. We've been practicing this for 30 days. I now know when I'm going to need my rescue inhaler. I now know when I'm going to need my controller meds, and I've got it down. I've adopted it as a habit in my life, and I'm good. I don't need to be looking at an app every day to stay on track. And what's interesting is that last category is a really interesting category of patients, because you're looking at it from a how much did you invest to get that patient engaged versus the ROI that you really changed that entire trajectory for that patient for a multitude of years. And so the cost implication of that in particular patient type is very different. Now, for a startup company like I see all those patients. And at the end of the day, when I shared those cost metrics earlier, that cuts across all of those types of personalities and ways of engaging with us. And so in that last category, I'm less concerned about engaging. I'm more concerned about getting that patient to the get it, got it good place. In that middle category, I want to catch them before they fall off or have an adverse event. And so I'm going to be looking for some leading indicators on when are they likely to wane out of the program. And in that first category, I'm looking for that right-sized engagement model where they are supported, but I'm also mindful about that investment. And cohesively, how do I then think about that entire cost portfolio and cost impact that I can have, or the value that I can create? And last thing I'll say on that is that value to me, when I talk about value and cost, given the populations that I work with, I not only think about how does this impact payers or health systems from a cost perspective, but I also think about the patients and the real lives that patients have to change when they have an adverse event and they get hospitalized and they have to cancel a trip to Disney with their family that they do every year because this year they can't afford to do it because they had 2 hospitalizations. The stories that we hear are very real, and I would be paying a disservice just to acknowledge how this impacts payers and health systems, but also the patients.
Yeah, I think just one thing to add on in the engagement conversation is that successful engagement is different for every product because every condition is so different. So it's not necessarily equivalent to Facebook or Instagram engagement where you just want people to scroll all day, every day. There are some products that are ongoing for life, and there are some products that are on a 28-day, twice a day for a certain amount of time course of treatment. It's similar to a dose of medication. So working with your vendor or your digital health company to discuss what does success look like in terms of engagement is really important, because they won't be the same.
Absolutely. It's a great point. I think we have time for just one more. And so I want to talk about the role that digital is going to play in ongoing value-based care delivery. So Susie, you want to start with that one?
Yeah, I think this one to me is really brief. I think it's going to be a cornerstone, and it goes back to what Jessica said. You have so much more data that gets generated from digital that when you want to predict and prevent, when you want to intervene, or you want to make sure that a patient is staying consistent on a therapy and has that persistence and adherence, I think that this is really, really going to be a cornerstone going forward. Now, it isn't going to be the only thing. And I often find that hardware, software, and and that human touch and clinical escalation pathway are so important as well. But I think that digital is going to continue to play a really big role and a growing role in this space, just from that data perspective in terms of interventions.
Yeah, I totally agree. I would loop into the provider and the health plans. When you think about an ACO model, for example, really rallying around the best care to minimize costs ultimately, you need everybody working together, throwing the best tool for the right patient at the right time. And then ultimately you will see those costs decrease or be managed better. With everybody working together towards that goal.
Yeah, I love that. I think that's such an important point about everyone working together and getting alignment on what outcomes you're looking for, what you're trying to accomplish. So I think that's a great place to end it. I'm going to invite Garrett back to close us out.
All right. Well, thank you guys so much. This was a wonderful presentation. And obviously there's a lot here and there's a lot to discuss. I'm sure we could go on and talk about these things all day. But the good news is that we're going to be sending out the recording here so you can review it and share it. And if you'd like to reach out to us, please do so. You will see the information here for the Propeller Health team, so you can reach out to them. And also would like to encourage you guys as we wrap up to head over to bbcexhibithall.com and check out the Propeller Health virtual exhibit booth there. There's a lot of really cool resources and things that you can read up on them and what they're doing in the value-based care space, and of course, contact their team through there, really educate yourself on some of their solutions. But I wanted to thank you again. Thank you, Jessica. Thank you, Susa, for joining us today. Thank you, Jillian, for your help in the Q&A. And we hope that all of you have a wonderful rest of your day and a happy holidays coming up here soon. So thanks for joining us.
Thank you, Jessica, so much. Thank you, Garrett. Thank you, Jillian.
All right, we'll see you next time, folks. Bye-bye.